So we treat U.S. military veterans. That's about a fourth or fifth of our clients. We've done it for several years. We have a very good relationship with the VA. And what we find with veterans, and everyone's different. It's hard to generalize when it comes to any group of people, right? With veterans, we treat them through the foreign medical program, which means they're traveling or already living abroad or whatever. So recently veterans from the Philippines who live in the Philippines have been coming to us, right? And they come to us or have interest in us because, well, number one, they have a substance abuse issue, right? Usually mental health, PTSD is a big one, of course, depression, and that could come from that could be combat related or non-combat related. It doesn't have to be. It's a mix. Our client's a mix of whether they're in combat or not, but they come to us for a few different reasons. One is they need help and work nearby, right? We're closer to the Philippines than the U.S. Two is maybe the centers they want to go to in the U.S., which would be, high quality places. Maybe there's a waiting list, or maybe, they can't get in right away. And then, I think a lot of veterans come to us because they want something a little bit different, right? They want that Thailand Eastern feel of something. They want to learn, meditation and mindfulness. And, we have veterans doing yoga, and I didn't understand at first because you would assume veterans like gung-ho, no yoga, like climb mountains and do weights, right? And that's the case with some of our veterans, sure. But then we have another section of our veterans who don't want to fall into that stereotype that want something different, right? And you have to realize, like, people who join the military in general are looking for adventure. They're looking to do something different, right? They're looking for purpose. They're looking to help their country. So those streaks of things still apply to people. That person's still there, right? Even after the military. And a lot of people are looking for something different. They're looking for adventure. They're looking to explore. They're very adventurous people. So ultimately, and then they see that, we're arguably, of course I'm biased, but by most standards and measures, we are the number one or among the top, couple treatment centers in Southeast Asia, right? And so they think, well, and because we can cover them with the FMP, a lot of treatment centers that they, like the veterans can go to, but they have to pay up front, right? And then they get reimbursed like 8 months later by the VA. With us, we cover it up front. The veteran doesn't come out of pocket, so they can come to us for 60 to 90 days, and we pay for it, and then we get reimbursed by the VA 8 months later. So that's how we do it, and that's a big draw, because who has most people, especially if they're living abroad and they're on their veteran disability or whatever, like they don't have tens of thousands of dollars to throw at treatment for themselves. So that's a big draw, and also that we have a trauma track for them. A lot of them dealing with PTSD. A lot of them have never been to treatment before, which is strange and or surprising. Maybe not strange, but surprising to me. And we get veterans who are as old as 65, 70 years old, and we get veterans who are 30 years old. But they come to us because they know we treat the addiction, but we also treat the underlying conditions. And for a lot of them, it is PTSD. And so we get them on that track. And that's why for our veterans, we want to see them do 60 to 90 days, because we need at least that time to treat the PTSD. We can't get them in for 30 days and treat that properly. And if it's not treated properly and they go back out there, the risk of relapse is high, and we're really not doing our job. So that's a big thing. And The food's amazing too. I think that applies to people in general, but when we're talking about benefits, I mean, there is a sparkly side of things, right? Like, it is a luxury rehab. You get your own room, big space, big bathroom, TV, big aircon unit, comfortable bed, share a pool with 3 other people. You eat amazing food, a mix of Western and Thai. Go on excursions. It's a really nice place. So a lot of people see that, but that's not why we accept people. But they see it. They see it as a place, whether veteran or non-veteran, that they can actually enjoy and get sober at. But yeah, that's where it comes from. Ultimately, for our veterans, just to circle back, it's for people. They want help. They want to stop drinking or using drugs, and they want to deal with whatever's going on inside of them. That's the biggest reason they come to us. And they're like looking around, and they're either they've been out of the U.S. for a while and they're scared to go back, or it's too far away. It's 22 hours of flights to get back. So, and they might need urgent care, or they might need to detain, whatever it is. Those are the biggest reasons that they come to us, and they read our reviews too, and so they know, like, okay, this works. I mean, we have our clinical director is a veteran, and he managed VA treatment centers for, I believe, 20 plus years, in addition to his service, in Afghanistan and other places. He's a wonderful guy, been treating veterans for a while. Our clinical operations manager is a veteran, and one of our admissions team is a veteran, combat veteran, and so those are just a few of our team that are actually veterans. And then also some veterans, not all, again, because there's a section of veterans who are looking for something different. They're not looking to just go into a veteran program where it's all veterans. Some of them intentionally want to come to us because it's mixed in with, civilians and around the world. But some veterans do want to be around other veterans, right? And they want to have a therapist who is a veteran, and they want to have fellow clients who are veterans. So we talk about that stuff as well. But, I think it's a good mix of people to where they don't feel like they have to be their perfect, military self when they're coming in, but they also can relate to people who have been in combat and other things.